eyes, ears, nose, and throat assessment. We're gonna do a neurological assessment. We're gonna do a cardiac and respiratory assessment, okay?
Okay.
So, let me just wash my hands real quick, and can you give me your name, date of birth, and your age?
Megan Smith, 0109, 2001, and 24.
Okay, let me just check your wristband real quick. Alright, perfect. Let me get my little notepad out. So the first thing I want to go over is your vitals real quick. Your BP is 116/68, your pulse is 72, and your respirations are 16. Does that sound about right?
Yes.
Alright, perfect. And before we go any further, are you on any meds or do you have any allergies?
No.
Alright, perfect. My pen real quick. Alright, the first thing I want to do is just do a general inspection, like know where you are and everything.
Yes.
This is part of your neurological assessment too. So you're at the doctor's office. Do you know your name?
Megan Smith.
Okay. Do you know who the president is?
Yes. Trump.
Okay. And do you know what year it is?
2024.
All right. Perfect. So you're making good eye contact with me. You know, you're very well dressed. Your hair is kept up. Everything like that. That's perfect. All right. Perfect. Let me just write that down. I don't see any physical deformities on you. Your appearance looks good. That your skin color looks good. You're not having any issues with that, are you?
No.
Alright, perfect. So, what about your speech, hearing, and your vision? You have any issues with that?
No, ma'am.
Alright, perfect. Let me just write that down. Alright, we're going to start your skin, nails, and hair assessment.
Okay.
So, let me look at your hair first. Hair looks clean, free of dandruff and all that. I will look at your skin. Your skin's temperature feels good. Let me check the turn of your skin. This is just elasticity. Perfect. Perfect. Okay, now I'm going to do your capillary refills. So I'm just going to press them on your fingers. Refills in 2 seconds. Perfect. Refills. Perfect. I'm going to check for edema too while I'm right here. I don't see any edema. Edema right there. And you have no clubbing of your fingers. Perfect. Alright. And you're not having any skin issues or anything like that, are you?
No, ma'am.
Okay, and one more thing. So I want to do it's the Braden Skin Assessment Scale. All it means is there's level 1, 2, 3, 4. So you'll be at a level 4 because you have mobility. You keep your skin free of moisture. You're able to get up and go. You don't have any skin tears or anything like that. You're young, obviously. I doubt you would. But one thing about it, smoking. That can cause circulation of your blood not to be flowing right and easy as skin tear.
Okay.
If your mobility starts to be limited. Another one, if you keep your skin moist, it's easier to tear. And another one that I always like to point out is that if you have any medical tape or a Band-Aid on you, the most important thing to do is run it under some warm water so it can come off easy. Because if you rip it off, it might give you skin tear.
Okay.
But do you have any skin issues that you want to tell me about? Any lesions or spots that you would want the doctor to look at?
No, ma'am.
Okay, perfect. Okay. And no limitations, right? You don't have any. Okay, perfect. Now we're gonna do we just did your neurological assessment, just asking if you're conscious and everything, eye contact. But I wanted to go over the Glasgow Coma Scale, and all that is just a scale we use when somebody's been in a coma or had a TBI. It's level 1, 2, and 3. If you recognize, you can recognize sound, somebody talking to you, your hearing, your vision, and all that. But you haven't had a TBI or got hit in the head real hard, like a concussion. All right, perfect. Okay, now we're gonna move on to your head and your face. I'm just gonna feel your head around, see if you got any lumps, bumps, anything like that. No, I don't see that. When I'm looking at your head on, you got good facial symmetry. I don't see any deformities, anything like that. Are you having when you look in the mirror, do you notice any twitching, or have you ever noticed any asymmetry in your face, where it's not even?
No.
All right, perfect. No drooping or anything like that?
No, ma'am.
All right, perfect. Now we're gonna move on to your ears. When I look at you head on, your ears are even. When I look at your tragus, this little notch in your ear right here, they match your eyes. That's perfect. We're gonna do the hearing test. And I'm just gonna stand a few feet back, and I'm gonna whisper 3 words, and you just repeat it back to me. Hot dog, hamburger, chicken.
Hot dog, hamburger, chicken.
All right, perfect. I'm gonna come over to the other side. Car, truck, van.
Car, truck, van.
Perfect, perfect. So are you having any issues hearing or anything like that?
No, ma'am.
Alright, perfect. Now, we're gonna go on to your, eye exam. We're gonna do pearl, that's just your pupil size, the roundness, reactive to light, and then accommodation. So, just look at me head on. Your pupils are in 5, that's normal. You have good roundness, they're even and everything. We're just gonna shine this light in your eyes and go back like that, and it's just check for reactivity. Okay. Alright, they both react. They react, you go down to a level 2. That is perfect. So 5 normal, and then 2. So do you have any problems with your sight? Do you have like any floaters or anything, any blurriness, any black spots?
No.
Alright, perfect. Now we're gonna go over to your nose. Just look towards me again. Your nose looks even. What I want you to do is put one finger right here and then breathe in. Okay, now the other side. Okay, perfect, all even. So are you having any trouble smelling, or like, you know, have you noticed you can't smell certain things when you cook?
No.
Alright, perfect. Now, after that, we're gonna go on to your nose, or not your nose, your mouth, throat, and neck. So can you just open your mouth for me? Okay, I don't see any lesions, no white spots, your lips look moist. Alright, I'm just gonna hold your neck right here, check the symmetry and all that, make sure it's even, and I just want you to swallow for me. Okay, perfect. So are you having any issues swallowing or any lesions that you might notice on your mouth, like canker sores or anything like that?
No.
Alright, perfect. That is great. Alright, we're done with that. You look all good there. Now we're gonna do your cardiac assessment. Can you just look over that way real sharp? Okay, good. And just check on for jugular vein distension. Perfect. We already checked you for edema, your capillary refills, we checked the temperature of your skin. That was all good.
Okay.
Alright, now since we did that, we're gonna do your heart sounds. I'm just gonna check all the chambers of your heart, that's all. Your aortic, your pulmonary, your herbs, triskelic, and then your mitral. Okay, that all sounds good. And then I'm just gonna check your apical pulse right here. Alright, 78. That is great. I can press this down. Okay, and now I'm just gonna check all your pulse points, okay? Your carotid is out of 2. Your axillary out of 2. Okay, your brachial out of 2. Radial is out of 2 on both sides. Your femoral. Good. Lapel. Good. 2. Okay, and then your dorsal toe. Okay, perfect. They all feel great. So, are you having any heart pains or anything like that?
No.
Nothing going on, like you don't have any racing of your heart or anything like that?
No.
Alright, perfect. Now we're gonna do your respiratory assessment. Can you just take a few deep breaths for me? Okay, so when you breathe, your chest looks even, both sides rise evenly and everything, and as we've been talking, you haven't been short of breath, you haven't been like, you know, can't catch your breath or anything like that. Alright, so I'm just gonna check your breathing sounds real quick. And that's 4 on the front, 2 on the side, and then 2 in the back.
Okay.
I'm gonna get it right. Okay, every time I touch you, just take a deep breath. Okay. Alright, put this arm to your shoulder. Okay, now lean up for me.
I'm not quite sure how to help you with that.
Alright, perfect. Those all sound good. Alright, so I remember them telling me earlier you had a little bit of a cough. So is the sputum, is it like clear, yellow, green, red?
Clear.
Okay. So what I want you to do when you are experiencing like that, like congestion, or like you're having like a little cough, can't catch your breath, I want you to lay down on your side. So you're gonna turn, you're gonna take a deep cough, and then you're gonna take a deep breath, and that should clear a lot of stuff up.
Okay.
And then what I have right here is an incentive spirometer.
Okay.
All you do is you take a big deep breath into it, and like you blow into it kind of like a breathalyzer, and then you're gonna let there's this little silver like ball marble looking thing, and it's gonna shoot up. So what I want you to do, like for 5 minutes a day, or like 5 minutes every 2 hours, I want you to breathe into this, and we're gonna try to get it to the 4,000 instead of the 2,000 where you're sat down. Okay? Is all. Okay, and then are you having like any shortness of breath? Like when you exercise, are you noticing like you need like more excessive than normal? You can't catch your breath.
No.
All right, perfect. Okay, so the last thing we're gonna do is your musculoskeletal assessment. I'm just gonna check the range of motion on your elbows, your wrist, your knees, and your ankle. Okay, and then we're gonna do a balance. Like you're gonna walk for me. I'm just gonna check your gait and your balance. Okay. So what I'm gonna do is I'm gonna hold your elbow right here, and you're gonna flex. So flex is this. You're gonna be straight, then extension, then hyper extension. Okay. So flex, or that's extension, then hyper extension. Okay. Now do it with some resistance for me. All right, perfect. Now let's do it on the other side. Here, flex, extension, hyper extension. Okay, now with some resistance. All right, perfect. Now we're gonna do your wrist. We're gonna do supination and pronation. Supination is up, and then pronation is down. Okay. This one. Okay. Nice. All right, perfect. Now supination, pronation. All right, now with some resistance. Okay, perfect. Now we're gonna do your knee, and then we're gonna do your ankle. So this is extension, and then this is flexation. Okay. So extension, flexation. Now with some resistance. Okay. Alright, that's good on that side. Extension, extension, flexation. Alright, now with some resistance. Okay, and then put up. Alright, perfect. Just write that down before we do your ankle. Alright. Now we're gonna do dorsal flex, which is up, and then plantar flex, which is down, okay? So dorsal flex, plantar flex. Alright, dorsal flex, plantar flex. Alright, perfect. Alright, put it straight. Dorsal flex, plantar flex. Alright, now then do that resistance. Dorsal flex, plantar flex. Alright, perfect. Now we're just gonna do now to check your gait and your balance. You're just gonna do heel to toe. You're gonna walk forward for me, and then after that, when you come back, you're gonna do heels. Just walking on your heels like this. Okay. Alright, perfect. You look like you got a good gait. Alright, the last thing I just want to do is I just want to do your pain assessment real quick. So, they told me that you were in pain. So they told me that you were in pain. Can you tell me where that pain is?
Mostly in my throat.
So in your throat.
Yes.
Okay, can you tell me what that pain feels like? Is it stabbing, scratchy, anything like that?
Scratchy.
Okay. Now, can you tell me, so you said throat, you told me the quality. Can you tell me like the number, like 1 being not too bad, 10 being awful?
A 2.
Okay, 2. Now, is it stopping you from doing anything?
No.
You sure? Like, talking or anything like that?
Well, toward the end of the day, it's harder to talk.
Okay, so it stops you from talking. Now, and you said it affects you mostly during the end of the day?
Yes.
Okay. mostly just water.
Okay, so water helps you.
Okay. Alright, I think that is everything. Do you need anything else from me?
I think we're okay.
Alright, well, I will let the doctor know everything and we will get going.